Okay, this video is called What Causes Carotid Artery Atherosclerosis. Here is the internal carotid artery. This goes up to the brain. It's differentiated from the external carotid artery, which has a lot of branches. It goes up to the face. So that's what you need to know. Internal carotid goes to the brain. This is the common carotid artery coming up here, and then this is the bifurcation, the carotid bifurcation in the neck. Okay, and the reason I became interested in this is I've seen many thousands and thousands of these things. I've done many hundreds and hundreds of catheter arteriograms of the carotid artery in the neck, and I've read thousands and thousands of CT angiograms, CAT scan arteriograms, and magnetic resonance arteriograms, MRAs, CTAs. And anyways, here's the pattern I see. I see a normal looking carotid artery, which typically has sort of an outward curve to it. It sort of becomes a little bit dilated right at the origin of the internal carotid artery normally, and it's curved like this. So here's the bifurcation, external carotid with all the branches going to the face, internal carotid going up to the brain. All right, well, here's where it gets interesting. What I usually see is it looks normal, normal, bad. And it's kind of reminding me of duck, duck, goose. This is a catheter arteriogram right here, and it's matched with the same patient. This is a magnetic resonance arteriogram, MRA, like related to MRI. And the point I'm trying to get at is it's not like a typical analog thing where it starts out 10% narrowed, 30% narrowed, 40% narrowed, 50%. It either usually looks normal or it jumps to around 50, 60, 70, 80%. Now, don't get me wrong. Sometimes there can be a gradation of stenosis, but I'm just telling you, I've seen many thousands of these things, and it's very common. It goes duck, duck, goose, normal, normal, bad, normal, normal, bad. The patient hits a tipping point, and things go to shit, and then you have a messed up carotid artery, okay? Little pieces of plaque can break off and go to the brain and cause a stroke. Often a small piece will break off first, and that'll cause a TIA. That's a small mini stroke or a transient ischemic attack, and it can be completely reversible as a characteristic finding. Now, here's a picture, of the carotid artery going up to the brain, internal carotid artery in this elderly gentleman. One of the things you notice is that the atherosclerotic plaque tends to be most bulky on the side wall away from the median divider. So here it comes up, hits the median divider, the high pressure blood, bounces off, and it'll cause injury to the median divider itself, but especially to the far wall is where you form a plaque. And atherosclerosis is a blood clot. That's important to know. That's super important to know. Here's an example of an atherosclerotic plaque where little pieces broke off and then they go up to the brain and they'll cause either a TIA, transient ischemic attack, or they'll cause a stroke. Now, here is the red blood cells, and normally red blood cells flow independently of each other, but there are bridging molecules that will stick them together. Typical RBC is about 7 microns in diameter. The capillary is typically about 5 microns in diameter, so normally the RBCs have to fold back upon themselves a little bit just to float through the capillary. When they're stuck together by a bridging molecule, and the bridging molecule can be LDL cholesterol, so that's important. LDL cholesterol is a bridging molecule. Also, the natural blood clotting protein, fibrinogen, is a bridging molecule. Uric acid is a bridging molecule, what's elevated by high fructose corn syrup and by eating meat. You can also get blood sludge related to chylomicrons and triglycerides, elevated fats in the blood, okay? Normally, blood flow should be a laminar profile, meaning that the red blood cells are in the center, they're going fast. It's also sort of a parabolic velocity profile of the blood. Red blood cells in the center, white blood cells next to them, and then on the outer surface of the flow column is the plasma, which is absent of cells. And that runs right next to the glycocalyx covering of the endothelial cells, okay? So here's what happens with the blood. It comes up the common carotid artery and it hits the median divider. That's all normal, and there's always a little bit of turbulent flow and a little bit of retrograde eddy currents. But when there's excessive hypertension, high blood pressure, it will hit the median divider much harder, and you'll get more chaotic flow. More turbulent flow just means chaotic flow. And you get more retrograde eddy currents. Eddy current just means backwards flow. Well, when you have an excessive amount of turbulent flow and an excessive amount of retrograde eddy currents, that will confuse the arterial wall. It will shed its antithrombotic glycocalyx, glycoproteins. They're kind of like trees on top of a hill. And then underneath those you have prothrombotic molecules like VCAM, vascular cell adhesion molecule, and a blood clot will form. It typically forms on the far wall. So that means here's the near wall to the median divider, here's the far wall from the median divider. That's the classic spot where it forms the vast majority of the time, and it forms most severely in that location, and it forms a blood clot. Okay, what happens is the blood clot forms on top of the endothelium, but then circulating precursor cells, endothelial precursor cells, cover it up, and that's how it becomes subendothelial. That's worth knowing. Okay, here's an example of what stenting looks like. In this patient, they showed the internal carotid on this side. That's sort of poor taste, but they did it. You can see how the plaque's thicker on the side away from the median divider. Stent is advanced into the stenosis, the narrowing, over a balloon. The balloon is inflated, then the stent is expanded, and the stent it almost really looks like a soda pop can, but fenestrated without the top and the bottom on it, and then that pushes the plaque up against the sidewall of the artery to allow blood to go through. And yes, it can work very nicely, but it's also a little bit risky that there could be embolization, during the procedure, and clot can form subsequently on the stent, but it sometimes has its benefits. The best thing, of course, is be a low-fat vegan and prevent the whole thing. Okay, now here's how it looks in real life. It can be a little more complicated. So in this patient, this is a CT arteriogram, axial image, transverse image of the neck, and you can see there's almost like a double lumen here. And so you ask yourself, here's contrast material, here's something that's not contrast material, soft tissue, and here's contrast material. So why do we have that look? It could be a dissection, but it's not a dissection. It's an ulcerated plaque. I simply showed this to you to let you know that in real life, it's more complicated than those simplified drawings. They are correct, those simplified drawings, but in real life you get messier plaques with these ulcerations on them, this thing that bulges up into the unopacified region of the clot, okay, within the carotid bulb, the internal carotid artery origin, okay? I'm going to get to some more interesting stuff, but I had to give you that background. Okay, so like I was saying, it tends to be duck, 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 goose. Okay, so looks okay, patient screwed. Well, they're not necessarily screwed, but they got a real problem. So why do some people hit the tipping point, whereas most people are relatively unlikely till they get older, okay? And you got to remember, there's bifurcation. It's just one big bifurcation in the neck with the carotid artery, but there's tons and tons of little bifurcations all over the place in the coronary arteries. Also, when you get up into the brain. Okay. So increased age, you're more prone to have less nitric oxide being produced by your endothelial cells, more prone to clotting the blood. Fat people, more inflammation in the blood, more blood clots, more atherosclerosis. High blood pressure, we talked about how that increases the risk of atherosclerosis. Diabetes makes the blood more prothrombotic, and it also injures the endothelial cells, and that predisposes to thrombus formation, clot formation, atherosclerosis. High-fat diet causes blood sludge, okay, rouleau formation. Hypertension. Omega-6 cooking oils destroy the pancreas beta cells gradually over decades, and that predisposes to diabetes, which causes these problems. High animal protein, including skim milk, will cause increased cholesterol. T. Colin Campbell writes about that in the China Study and his other books. A lack of plant foods is the problem because everything, basically the common stuff in plants is antithrombotic. The potassium, the magnesium, the nitrate precursors of nitric oxide, the antioxidants, the vitamin C, maintaining the collagen of the arterial wall, and the fiber, dietary fiber, preventing leaky gut and postprandial endotoxemia, bacterial endotoxins being prothrombotic, okay, causing dense matted deposits, amyloid mechanism of clotting in the blood. Food toxins like glyphosate, they're associated with increased risk of leaky gut, fatty liver, diabetes. That's bad. That's why I only eat organic. High fructose corn syrup is associated with fatty liver. I got entire lectures on high fructose corn syrup, leading to elevated blood uric acid and diabetes. That's bad. Meat is associated with TMAO, trimethylamine oxide, and that is atherogenic, more blood clots in the blood. Meat's associated with xenosialitis because it has abnormal sialic acids that confuse the immune system. That causes inflammation, bad for blood flow. Sedentary patients get increased insulin resistance, so it's good to exercise. That has a similar effect as functional insulin to get the glucose type 4 transporters up to the plasma membrane so glucose can be taken into the skeletal muscle cells. So anyways, being sedentary increases risk of diabetes. Lack of sunshine. Sunshine sort of helps release the nitric oxide precursors from subcutaneous tissues. It also facilitates healthy sulfation of the endothelial glycocalyx, so it is good for your health. It's antithrombotic. I personally think all this wear your sunscreens all the time stuff is totally overrated nonsense. I mean, don't get me wrong. If you have to work all day out in the sun, you need something to protect you, but we need to get some sunshine. It's really good for us in many ways. Okay, MSG and MFG, monosodium glutamate, manufactured free glutamate, those are flavorants. You put that stuff on the food, people eat more. They tend to get fat, hypertensive, and diabetic. Artificial sweeteners also can cause insulin resistance and confuse our body's system for monitoring and measuring and controlling and regulating blood glucose. Alcohol predisposes to fatty liver, and diabetes. And what's his name? Lustig, that funny endocrinologist, metabolic guy, he says that high fructose corn syrup is alcohol without the buzz. Okay, because you don't get the buzz, but you still get fatty liver, which predisposes you to diabetes. Smoking tobacco is really atherogenic, causing blood clots, facilitating blood clot formation. F- in the water. Also, POFA, nonstick cookware, gradually have a toxic effect on pancreatic beta cells, thus increasing your risk of diabetes. Okay, Al in the water, aluminum, that is toxic to pancreas beta cells. Okay, these are gradual, mild effects, but they add up over the course of decades. Mouthwash and toothpaste with fluor-you-know-what-ide, that will kill the bacteria on the back of the tongue, which is the first conversion step of nitrates from the greens, the salads, being converted to nitrites, NO2s, and then they go to the stomach, and they're made into NO, nitric oxide, systemic vasodilator. We got estrogenic chemicals in the drinking water, like OCPs, birth control pills, bisphenol A, plastics, phthalate plastics, PCBs, and other ones. Estrogenic chemicals in the food and in the oral contraceptive pills, birth control pills. We got estrogenic chemicals in personal care products and deodorants and shampoos and dishwasher detergent and laundry detergent. And so these things add up, and they all predispose to increased obesity and increased risk of atherogenic disease, increased risk of autoimmune disease. Being dehydrated makes your blood thicker. Calcium supplements, when over 1,400 milligrams per day, increase your risk of a cardiovascular event, forming a thrombus in your blood, perhaps because calcium is a clotting factor, and you get a transient spike in it when you take a big supplement. Okay, leaky gut and leaky gums then allows bacterial endotoxins like LPS and LTA to get into the blood, and they're prothrombotic. They have like a catalytic effect to becoming prothrombotic. I think that's quite under-recognized, and that it causes something called amyloid clotting. I've given several lectures on that. Mitochondrial inhibitors in food and drugs are also associated with causing insulin resistance and diabetes. Not good. SERCA inhibitors, sarcoplasm, endoplasmic reticulum, calcium ATPase inhibitors. I've talked about that in a lot of my lectures on the brain. They're associated with increased risk of insulin resistance, and I would say anything that smells bad is bad for you. That's worth remembering. Your nose is there to protect you. Elevated serum ferritin, the iron, when excessive amounts are free, that also becomes autocatalytic to predispose to blood clot formation, amyloid clot formation. Then ferrous redox cycles between Fe2 plus and Fe3 plus. Increased uric acid in the blood, it's a vasoconstrictor, causes insulin resistance because it vasoconstricts the muscle, so the insulin can't get into the non-active muscle capillaries. Thus, the insulin can't make its effect to help those muscle cells store glucose for making glycogen. Excessive stress increases cortisol and catecholamines, which makes the blood more prothrombotic, causes some platelet activation as well, also predisposes to obesity. Stress equivalents include sleep deprivation and caffeine. That's another reason why the stuff's not good. Anybody with kidney failure, they start having elevated factor 7 and factor 8 and fibrinogen and platelet activation, all of which predispose the blood to clot formation. So what I'm basically saying here is that people keep accumulating diseases and health problems and dietary problems and lifestyle problems that predispose their blood to clotting. And when they're 20 years old, their body can fight it off pretty well. But the older they get, the sicker and weaker they get, and the more prone they are to just hitting the tipping point where they start forming carotid atherosclerosis and atherosclerosis in the other arteries of the body, especially the heart, the Johnson, etc. So what's the point of all this? The point is, just be aware. Here it is, 20 things that are predisposing you to a clot formation. I actually had a list of like over 30, but I lost it, and I could make it again, but I don't got the time right now. So I'm just trying to show you. This is one of the reasons why I say it over and over again. The older you get, the more fragile you get, and the more you need to pay attention to optimizing all the health parameters you can. Because no matter what you do, you're going to be exposed to some things that have a little bit of a negative effect on you. I forgot to mention EMF, smart meters, all that stuff have a mild prothrombotic effect on the blood. They have a mild sympathetic activation effect, okay? So you don't want to hit the tipping point and, potentially pass into the high stroke risk thing. Okay, well, I'm going to leave it at there for now. I hope that was helpful.